So good evening. My name is Dr. David Gaze. I'm Senior Lecturer in Chemical Pathology at the University of Westminster, and I'm also Director of Scientific Affairs at the Association for Laboratory Medicine. So what I'm going to do this evening is talk to you about heart disease and how we can use biomarkers in your blood to assess the format of the development of heart problems that we can get over our lifetime. And the underlying disease here is atherosclerosis, or what we now term atherothrombosis. And this is where we have cholesterol from the diet and from within the body that is deposited in the arterial wall, which causes thickening in the arterial wall, reduction in the space allowing the blood to flow to the heart muscle. And over time, these plaques can become destabilized and they can rupture, and then we form a clot over the top of that, a thrombosis or a hematoma, which then further reduces blood flow. And we can do a number of tests in the laboratory to assess the progression of this disease, from vascular and metabolic risk markers, such as your cholesterol and your lipids and the fats, markers of inflammation, and then markers associated with those necrotic processes and remodeling of the heart once a heart disease has taken hold. So the biggest risk really is a heart attack, which is known as an acute myocardial infarction. There's over 700,000 people that present to the emergency department every year with chest pain. There's a multitude of signs and symptoms, but only around about 10% actually have a heart attack. And you can see an ECG trace there, which is indicative of a heart attack, but that only occurs in around about 45% of those 10%. And so there's a huge number of people that present without changes to the ECG, and we can use this biomarker called troponin. It's involved in muscle contraction. You can see the video there of the contractile apparatus. And when the cells die, we release this troponin into the circulation, and we can measure this as blood tests. We can do it on point of care or in the central laboratory to allow rapid diagnosis. We're very good at keeping people alive after heart attacks now, and patients will go into chronic heart failure during the course of their life. And you can see here, this is the changes that happens. We have thickening of the heart, the hypertrophic response. And in response to that, we have a fluid overload and increase in blood pressure. And the heart will release proteins called natriuretic peptides, which cause vasodilation and diuresis to try and physiologically resolve this problem. We can use these as markers of a severity of heart failure. You can see on the bottom on the right-hand side the NYHA classing. So as the class gets worse from class 1 to 4, we have an increase and they're associated with poor prognosis. Again, we can do them at point of care and in the laboratory. And it's not just humans that get heart disease. I've been very privileged to work in a multidisciplinary team looking at heart disease and scanning for cardiac disease in patients, animals. So we have the apes and monkeys. And at the bottom there, we also have an image of a 32-foot python at Whipsonade Zoo, which was scanned as part of health checks. And we do this on a regular basis, and we use these proteins and biomarkers to assess their cardiac function. So it's great to work within both the humans and the vet world as well. Thank you very much.